Learning outcomes. Dear students, after studying this module, you shall be able to know what does the term phobia actually mean, what are the signs and symptoms of phobia, what are the causes of this disorder, what are the different types of phobias, and about effects and diagnosis of phobia. First, the introduction to phobia. The term phobia is derived from the Greek word phobos, meaning aversion or morbid fear, which is generally used in the context of the fear of anything or any situation wherein the individual avoids circumstances, persistent fear of an object or situation in which the sufferer commits to great lengths in avoiding, characteristically disproportional to the definite danger posed, frequently being acknowledged as irrational. Thus, phobia can be defined as the irresistible and unreasonable fear of a thing or situation which incites nervousness and avoidance but poses little real danger. A phobia lasts long, thereby causing strong physical and mental reactions that may affect the individual's capability to work normally in social settings, unlike that of the fear caused when people deliver a speech or take a test. There are various types of phobias that we have encountered or heard about in our life. Some people have fear of large and open spaces, while some have fear of small and confined spaces. Others are unable to tolerate certain social situations, and still others have a specific phobia such as a fear of snakes, water or flying. Now we shall look into the history of phobia. The first ever written reference to phobic problems can be seen in the works of the ancient Greek physician Hippocrates, in a man named Nicanor who was terrified of the flute. But Hippocrates didn't actually come up with the term phobia. About 500 years later, Celsus, a Roman doctor, employed the term hydrophobia to define the condition where the individual has fear of water due to rabies. According to a belief, the term was actually derived from the name of Phobos, who was the son of Ares, the Greek god of war. It was thought that Phobos was of alarming nature. It was also believed that fighters used to paint his picture on their armors to terrify their enemies. So, a phobic reaction resembles someone who is terrified of something. However, the first relatively modern use of the word phobia was made in 1786, when an unknown writer in the Colombian magazine defined the word as a fear of an imaginary evil or an undue fear of a real one. Normal fear versus phobia. It is normal and even may prove to be quite helpful to experience fear in dangerous situations and ask someone for help, as fear is an adaptive human response. But phobias are something more than this. Phobias are defined as a strong and unreasonable fear of object or situation which poses little or no real danger. Here the threat is greatly exaggerated and even non-existent. Fear is just a psychology that makes a person more anxious about certain situations and things. It is not generally coupled with the avoidance of that particular situation. On the other hand, in case of phobia, despite of understanding that the fear one is suffering from is an irrational fear, most individuals are powerless to override their panic reaction. For example, feeling anxious during flight is just a fear, but not going to an important event because one has to fly and thereby avoiding such a situation is phobia. Signs and symptoms of phobia. The signs of phobia may vary from minor feelings of nervousness and worry to a full-scale attack of panic. The signs and symptoms of all the phobias are generally the same, which are as follows. A feeling of uncontrollable panic and terror or dread when one is encountered with the source of his or her phobia. Even after having the knowledge that these fears are unreasonable or exaggerated, but one feels unable to control them. Increased anxiety resulting in inability to function normally. Physical as well as psychological reactions including sweating, chest pain, rapid heartbeat, difficulty breathing, a feeling of panic and intense anxiety. In children, as they are not very expressive, it includes clinging or crying. Phobias vary in severity among individuals. Some persons can only avoid the matter of the panic and suffer comparatively slight anxiety above that fear. Many individuals undergo dwelt panic attacks altogether accompanying disabling symptoms, despite of understanding that the fear they are suffering from is an irrational fear. But most individuals are powerless to override their panic reaction. Next is causes of phobia. The real reason on how phobias are caused is still unknown. However, there generally appears a link between the phobias of a person with the phobias of your parents. This could be due to genetics or learned behavior. It was also hypothesized that sufferings in childhood and observing members of family being injured or frightened may also result in phobias. The exact phases of phobias may not be recalled by individuals as the causes develop early in life. Rachman suggested 3 ways of attaining fear: classical conditioning, vicarious acquisition, and informational or instructional acquisition. First, classical conditioning. This type can be understood by the acquisition of fear responses in phobias that has been accredited to the Pavlov's model, when an aversive stimulus and a neutral one are paired together. For example, if a person is subjected to electric shock in a particular room, the subject starts fearing not only from the shock but from the room as well. In behavioral terms, this is described as a conditioned stimulus, the room, which is paired with an aversive unconditioned stimulus, the shock, which leads to a conditioned response, that is fear for the room. Next is vicarious acquisition. It is learning to fear something by observing others, that is by observing other individuals reacting fearfully and not by the person's own experience. For instance, when a child sees a parent reacting fearfully to an animal, the child can become afraid of the animal as well. Next is informational or instructional acquisition. It is learning to fear something by getting the information about it. For instance, fear in touching a bare wire after having heard that touching it will result in an electric shock. Next is types of phobia. In accordance with the Diagnostic and Statistical Manual of Mental Disorder, 4th edition, that is DSM-4, there are following 3 types of phobias which incorporate in itself a very vast variety. First is specific phobias. In specific phobia, anxiety is triggered only in specific situations. The signs might spread to psychosomatic manifestation of physical complications. It involves fright of a lone, particular panic trigger, for example, spiders, snakes, water, heights, etc. A particular phobia comprises of an unreasonable, insistent fear of a definite object or condition which is actually out of proportion to the genuine risk. This includes a fear of situations, being in a closed space or in a lonely place, nature such as thunderstorms or water, animals or insects such as dogs, lizards, etc. Certain situations like blood, injuries or accidents. There are many other types of specific phobias. It can comprise of apprehensions with losing control, freaking and collapsing, which are the direct result of coming across with phobia. An individual can suffer from various types of phobias. Social phobia. It is the fear of other people or social situations such as performance anxiety or fears of embarrassment by scrutiny of others. In addition to shyness, it also comprises of an amalgamation of excessive self-consciousness and disgrace in common social situations. In societal circumstances, the individual fears of rejection or being offended by others. The problem could be more complicated, especially in case of adolescents. A study revealed that about 20% of adolescents diagnosed with social phobia also suffer from depression and use alcohol or other substances. Fear of open spaces or agoraphobia. This is a comprehensive dread of leaving home or a small familiar safe area. It is an actual or anticipated situation such as using public transportation, being in open or enclosed spaces, being in a crowd or being outside the home alone. Most people who have agoraphobia develop it after having one or more panic attacks, causing them to fear another attack and avoid the place where it occurred. For some people, agoraphobia may be so severe that they are unable to leave their home. Next are the effects of phobia. Phobias are rarely life-threatening, but they can make sufferers unreasonably stressed. Some phobias also inhibit quality of life and make it difficult for sufferers to gain employment or education. Some of the possible effects of different phobias are disruption to normal daily activities. The sufferers of phobias often have prolonged anxiety that can affect their emotional well-being and their ability to function in their day-to-day routines. Alcohol and drug abuse. A study revealed that about 20% of adolescents diagnosed with social phobia also suffer from depression and use alcohol or other substances. Social problems. In case of social phobia, the person starts losing contact with the society to overcome anxiety or fears of humiliation and embarrassment by scrutiny of others. Increased suicide risk. People with extreme stage of phobia rarely may even attempt to commit suicide to avoid their unbearable situation. Next are the diagnosis of phobia. A diagnosis of any kind of phobia is made based on a full psychiatric evaluation, medical history, physical exam coupled with the laboratory test. First is psychiatric evaluation. The psychiatrist will ask a series of questions to the patient about himself and the situations and place where the patient is encountered with such anxiety attacks. Next is medical history and exam. The psychiatrist will ask the patient about personal and family health history. He or she will also perform a complete physical examination to check for medical issues that could be causing or contributing to the problem. Laboratory tests. While there are no laboratory tests that can diagnose phobia, simple blood and urine tests can rule out other medical causes of symptoms. The doctor may also order brain imaging studies such as an MRI or a CT scan in order to look for brain abnormalities associated with this disorder. We'll conclude this module with summary. A phobia can be defined as the irresistible and unreasonable fear of a thing or situation which incites nervousness and avoidance but poses little real danger. The first relatively modern use of the word phobia was made in 1786, when an unknown writer in the Columbian magazine defined the word as meaning a fear of an imaginary evil or an undue fear of a real one. The symptoms of a phobia can range from mild feelings of apprehension and anxiety to a full-blown panic attack. The actual cause is still unknown. However, there generally appears a link between the phobias of a person with the phobias of your parents. This could be due to genetics or learned behavior. Phobia can broadly be classified into three different subtypes, that is specific phobia, social phobia and agoraphobia. If the signs and symptoms of phobia are ignored or not treated properly, the consequence can be devastating for the individual. A diagnosis of phobia is made based on a full psychiatric evaluation, medical history, physical exam coupled with the laboratory tests. Thank you.